Hey guys, welcome back to the channel. My name is Omer, and I'm a doctor. My passion is to share valuable knowledge that can enhance and potentially save lives. My mission is to empower you with information that can make a real difference in the world. Today, we're diving into a topic that impacts the lives of millions worldwide: androgenetic alopecia, more commonly known as pattern baldness. If you or someone you know is dealing with this condition, you understand the frustrations it can bring. But don't worry, we've got you covered. In this video, we'll explore all there is to know about pattern baldness, including its symptoms, underlying causes, and the latest treatment options. So, hit that subscribe button and give us a thumbs up. Let's begin our journey into understanding and managing pattern baldness together. Pattern hair loss, also known as androgenetic alopecia, is a condition that runs in families and is caused by an excessive response to certain hormones called androgens. It's quite common and can affect up to half of all men and women. The main symptom is a gradual loss of hair on the scalp, which usually starts after puberty. In men, the hair loss is most noticeable at the top of the head and the front of the temples, while in women, the front hairline is usually preserved, but they may experience overall thinning of the hair towards the top of their head. Causes: androgenetic alopecia is a condition that is strongly influenced by genetics, meaning it runs in families, and it happens because some people's bodies are very sensitive to certain hormones called androgens. The condition is caused by a combination of multiple genes with different degrees of impact, and it can be inherited from both the mother and the father. If a man's father had pattern baldness, the son is at a higher risk of also experiencing it, about 5 to 6 times more likely. Androgenetic alopecia specifically requires the presence of androgens, which are hormones responsible for masculine traits. This type of hair loss only starts to happen after a person goes through puberty. Interestingly, males who are castrated before puberty or those with a certain medical condition called androgen insensitivity syndrome do not develop pattern baldness. This shows that the balance of hormone levels and how the body's cells respond to androgens are crucial factors in the development of this condition. How common is it? Androgenetic alopecia is most common in people of European descent, followed by Asians and African Americans. Native Americans and Eskimos are less affected. In Caucasian males, about 50% will experience some degree of hair loss by the time they reach 50 years old, and this number increases to about 80% by the time they are 70 years old. In females, the condition is also relatively common, and its incidence tends to increase after menopause, which is the stage when women stop having regular periods. A deeper understanding. I am about to give you a scientific explanation. Apologies if it is hard to follow, however, it is important stuff to know, so worth getting a good understanding. Androgenetic alopecia, also known as pattern baldness, is driven by the overactivity of hair follicles in response to androgen hormones. These androgens, like testosterone and dihydrotestosterone, also known as DHT, bind to specific receptors in the hair follicles, triggering a cascade of events that affect the hair growth cycle. In a normal hair growth cycle, there are 4 phases: anagen, this is the growth phase; catagen, this is the transitional phase; telogen, this is the resting phase; and exogen, this is the shedding phase. In androgenetic alopecia, the excessive activation of androgen receptors shortens the anagen phase. This leads to follicular miniaturization, where the affected hair follicles become progressively smaller, producing thinner and shorter hairs. Some follicles may become too small to even penetrate the skin surface. Scalp biopsies of individuals with androgenetic alopecia show a decrease in the ratio of anagen to telogen hairs, disrupting the normal hair cycle. The key players in this process are DHT, 5-alpha reductase, and androgen receptors. Type 2,5-alpha reductase is especially important, as it converts testosterone into DHT, which has a stronger affinity for androgen receptors and contributes to the hair loss process. History, physical and evaluation. Androgenetic alopecia typically starts gradually and occurs after a person goes through puberty. In men, it begins with thinning of hair at the temples of the forehead and then progresses to the top of the head, vertex. In women, the hair loss is characterized by thinning between the front of the scalp and the vertex, but the frontal hairline remains intact. Often, women notice a wider part in their hair or can see more of their scalp. For men, early androgenetic alopecia is defined as hair loss that starts before the age of 30. In women, pattern baldness can sometimes be triggered or revealed by a condition called telogen effluvium. This occurs when a significant stressor leads to a larger number of hair follicles shifting from the growth phase, anagen, to the resting phase, telogen, resulting in increased shedding of hair. The extent to which pattern baldness will progress is uncertain and can vary between individuals. Doctors can typically diagnose androgenetic alopecia based on a patient's medical history, including the gradual onset of hair loss after puberty and, sometimes, a family history of baldness. In most cases, a biopsy, removing a sample of tissue for examination, is not necessary unless the diagnosis is unclear. Using a tool called dermoscopy, doctors can observe miniaturized hair and brown parahilar casts, which helps distinguish androgenetic alopecia from other conditions like diffuse alopecia areata that may look similar. Diffuse alopecia areata will have hairs with tapered fractures that resemble exclamation points. To rule out other potential causes of hair loss and to investigate if there are any underlying conditions contributing to the androgenetic alopecia, a comprehensive evaluation is essential. This may include a review of the patient's medical history, medications they are taking, and a thorough assessment of their overall health. Certain tests such as thyroid studies, complete blood count, CBC, screening for iron deficiency, and syphilis may be conducted if relevant. Treatment. There are 2 FDA-approved drugs for treating pattern baldness, topical minoxidil and finasteride. Both drugs require at least a 4 to 6 month trial before seeing noticeable improvement, and they need to be used continuously to maintain their effectiveness. Adherence to the medication regimen can be an issue for some individuals. It's worth noting that these drugs tend to work better when used together. No treatment. Some may opt for no treatment after weighing up the risks versus benefits of treatment. Hair products containing nanofibers can help stick hair together to give an appearance of thicker hair. Minoxidil. This medication is available over the counter and comes in various strengths, with higher strengths being more effective. Common side effects include itching and local irritation, often due to certain ingredients in the formulation. Minoxidil widens blood vessels and blocks potassium channels, which is thought to improve blood flow to hair follicles, providing more oxygen, blood, and nutrients to promote the growth phase of hair. Topical minoxidil. Topical minoxidil does not alter the natural history of hair loss, but rather it can thicken/increase the density of remaining hair as a result of slowing down hair shedding. It is best used at an early stage. It is not effective for more established alopecia when patients are no longer reporting increased hair shedding. The 5% formula is recommended twice daily for men and once daily for women. Minoxidil comes as a solution or foam. If using the foam, then the correct amount is a large tangerine-sized blob. The response to treatment should be assessed at 6 months. If beneficial, treatment needs to be continued to maintain efficacy. Up to 40% of patients may benefit. Oral minoxidil is a relatively new treatment that has been shown in small studies to lead to significant regrowth of terminal hairs in some patients. A common starting dose is 0.625 mg per day for women and 1.25 mg per day for men. Patients should get a tablet cutter from a pharmacy and cut a 2.5 mg tablet into quarters or halves to get the correct dose. You cannot use this medication if you are pregnant or have severe liver impairment and cardiac disease. The response to treatment should be assessed at 6 months. If beneficial, treatment needs to be continued to maintain efficacy. 5-alpha reductase inhibitors in men. Finasteride or dutasteride are both commonly used medications for hair loss. However, dutasteride is not currently FDA approved for use in hair loss. These are type 2 5-alpha reductase inhibitor, which means they inhibit or reduces the type 2 5-alpha reductase and hence reducing the conversion of testosterone to DHT, and this in turn then starts promoting hair regrowth on the scalp's vertex. However, it's thought not to be as effective for frontal baldness. It has uncertain efficacy in female pattern baldness and is not safe for pregnant women. Dutasteride 0.5 mg per day appears the most effective with an increase in the total hair count and improvements in serial photographs. An alternative is finasteride 1 mg per day. Studies have suggested using 0.25 mg can be as effective and have a lower side effect profile. Higher doses of finasteride more than 1 mg per day provide no additional benefit for hair loss. If successful, treatment needs to be continued to maintain efficacy. Up to 2 out of 3 patients may benefit. Before prescribing such drugs, patients need to be aware of the following. Not all patients benefit from treatment. There is a small risk of altered libido, meaning sex drive, erectile dysfunction, and ejaculation disorders, which can persist in some even once treatment is stopped. These drugs are normally used to treat prostate growth, so may result in a reduction in PSA, prostate-specific antigen, levels. The actual PSA level may be twice as high as what is reported. Wigs can be considered for patients with moderate to severe alopecia. Patients can be referred, normally to local dermatology departments, for the provision of wigs, which are of sufficient quality to normally make for a good cosmetic appearance. Surgery, follicular unit transplantation, FUT, can be performed in both male and female patients, although the outcomes appear better for men. Patients need to have sufficient donor hair. The best site is from the neck region of the scalp. Outcomes are variable and depend to a large extent on the skill/experience of the surgeon. Treatments are very expensive and patients need to give considerable thought before having such a procedure performed. Differential diagnosis. When evaluating hair loss, several conditions should be considered in the differential diagnosis. Alopecia areata, an autoimmune condition that causes patchy hair loss on the scalp or other areas of the body. Anagen effluvium, hair loss that occurs during the anagen or growth phase of the hair cycle, often due to chemotherapy or exposure to certain toxins. Syphilis, a sexually transmitted infection that can cause hair loss as one of its symptoms. Systemic diseases, certain medical conditions like thyroid disorders or lupus can lead to hair loss. Telogen effluvium, hair loss that occurs when a significant number of hair follicles prematurely shift from the growth phase, anagen, to the resting phase, telogen, due to physical or emotional stressors. Conclusion. Pattern baldness, or androgenetic alopecia, is common and concerns many for cosmetic reasons. Dermatologists often encounter it, however, beware of internet remedies. Patient education is key, and pharmacists play a vital role. There are health implications too: increased cardiac risk in men and links to polycystic ovarian disease in women. Sun exposure on bald scalps raises the risk of actinic keratosis, which are age-related lesions due to sun damage. Work alongside your healthcare professionals, whether it's seeking reassurance or treatment. They're here to help with evidence-based solutions. And that's it, guys. We have covered a lot of useful information today. I hope that this information will be a helpful resource for either you or someone you love. As a full-time doctor, my goal with this channel is to share my medical knowledge with all of you to help improve your overall health and well-being. If you found this video useful, please consider subscribing for more helpful content just like this. I'll be publishing a new video every week, so if you have any suggestions for future topics, please leave a comment below. Until then, take care of yourselves and stay healthy.